If it's hormone-fed breast cancer or hormone-positive receptors in your tumors, they put you on medicine for 5 to 10 years. I have to take this medicine every day, and it causes debilitating depression, anxiety, and incredible joint pain. When I get up in the morning, sometimes it will take me 5 minutes to get down my flight of stairs. And knowing that I can use cannabis to really help me function as a human being, to be able to walk, it's really been such a gift and such a blessing to be able to have a medical card. I'm Nancy Deol, and I've been using cannabis medicinally since 2020 for chronic pain caused by breast cancer prevention medicine. I am a mother, a wife, a small business owner in Manchester, New Hampshire. I'm also a master gardener, and in my spare time, I do stained glass work. Growing up, I was a child of the D.A.R.E program, so cannabis was kind of scary to me in elementary school, and it seemed like something that I wouldn't be interested in using. Then in high school, you get into a little bit more experimentation, or at least I did. And then in college, I felt like everybody was using cannabis. So cannabis was pretty normalized for me at that point in time. I wasn't as active of a cannabis user as I am now, and I didn't really understand the medicinal benefits other than it can help you with nausea or it can help with seizures, just the things that you see in the news. I was diagnosed with invasive ductal carcinoma, which is a form of breast cancer. It's actually one of the most common forms of breast cancer. And I knew that I wanted to get my medical card as soon as I was diagnosed needing to have chemo. I really had thought that I wouldn't need chemo. I was like, there's no way I'm going to have to do chemo. And then my testing came back and it was very serious that I had grade 3 cancer cells and I was in my early 40s. So they wanted to throw the book at me with 4 really intense double med rounds of chemotherapy. They were so intense I had to have them 3 weeks apart. Also, I had to do 30 rounds of radiation. The one thing that people don't understand is that when you're going through cancer treatment, you're going through chemotherapy, you're going through radiation, there's a lot of drugs that they give you. Everything from steroids to anti-nausea meds. They gave me one that was actually an off-label antipsychotic. So as soon as I knew those 2 things would be part of my treatment plan, I immediately decided I needed that medical cannabis card. I wasn't going to be throwing up all day. I wasn't going to be taking a lot of different meds on top of that to try to counteract the effects of the chemotherapy. I also knew that I wanted to understand what the best strains would be for me. And I knew the only way to really get a good consultation on how to use cannabis effectively to mitigate my side effects was to get a medical card. I started the process of getting my medical card in New Hampshire. And in New Hampshire, we are only a medical state. So my option here during the global pandemic was really medical or nothing. What I found out, which was kind of heartbreaking at the time, is that I had to already be sick to be able to qualify, but I actually had other qualifying conditions. I have Barrett's esophagus and I do experience pain from that, but I was also using it when I was ill from the chemotherapy to keep the nausea at bay. And it was a really depressing time too. It was very isolating to have cancer during COVID. So I spent a lot of time alone. I would sit in my backyard after chemo, and there's another drug they give you that boosts your white blood cell count, and it makes it feel like every bone in your body is breaking. I had some really serious pain and really serious nausea and the side effects from the steroid. I experimented at that point with all different formats of cannabis consumption. I used FICO oil, cannabis vapes, flower. I have a Levo machine to make infusions, and I did make butter. And I would also use edibles. Anything that could keep me happy, anything that could keep the pain away, where I didn't have to really rely on additional medicines and Tylenols and all the other things that are just really hard on the liver and hard on your stomach, as well as someone with Barrett's esophagus. It was just something that really helped me get through those very, very dark times. I would have gone and got cannabis anyway. It's decriminalized in my state, and I don't think my neighbors would tell on me for going through cancer and chemotherapy and all of these at the height of COVID. So one way or another, I was going to do this. But after I had a consultation at the medical dispensary, I've learned a lot about what strains really benefit my multiple medical conditions that I do have. I use cannabis on and off throughout the day, depending on how my body feels. I'm fortunate that I work for myself, so I can flex my schedule, but my tolerance with cannabis is at the point where I don't really get high. It just kind of takes the edge off any pain I have. It helps me focus, and I also use it before bedtime to help me sleep and take away any stressors from the day. Being able to just occasionally hit my vape or smoke a little flower or have an edible to help me with all of these depression, anxiety, and extreme joint pain and worry that comes from being a cancer survivor. So you're always thinking, when is the next shoe gonna drop? So the mental health benefits from cannabis have been really beneficial to my life and my family as well.
Learn more about cannabis and begin your medical cannabis journey at leafwell.com.